KRHD's Talley spoke to a local doctor on what athletes could face on the field.
Football players are prone to all kinds of injuries. That's what happened Monday night to Bill safety Darmar Hamlin. One doctor I spoke with says knowing the signs can save a life. The medical director for Premier ER in Bryan tells us serious injuries or medical emergencies can happen to anyone instantly, even the healthiest of athletes.
I mean, it has nothing to do with fitness. Most of these athletes, they're super fit, more fit than the general population. But because of this, inborn genetic predisposition, they just have an increased risk of going to cardiac arrhythmias.
One local high school athlete saying he does all he can to protect him and his teammates on the field for major injuries.
One of my main goals, I don't want to be injured over a sport that I played in high school for the rest of my life.
From the NFL to high school-aged football, Coach Howard Tipton with the Brazos Valley Mustangs saying he and his staff try their best to protect every player.
You could lose them for the season and actually affect the rest of their life, and then of course worse things. But ultimately, it's the responsibility of every coach, I believe, to make sure that their players are as safe as they can be, that we're watching for any sign of kind of distress.
Tipton says prevention starts with keeping his players' protective equipment up to standard.
That the NFL has obviously top-end gear, and even with top-end gear, you can get an injury like this. So as much of a fluke injury as it was, we're playing with a lot less nice gear. So we always try to make sure that it's as good as it can be, that it's positioned correctly. There's a chest plate there that's designed to help protect against something like this.
Dr. Wynn saying these are some symptoms to look for.
But before going to cardiac arrest can be unexplained passing out, feeling like the heart's racing, palpitations, unexplained excessive shortness of breath, and even chest pain. So sometimes if this happens and it's unexplained, I would definitely contact their primary care doctor or even go to the ER.
Dr. Wynn says another way to quickly act in situations like this is knowing how to administer CPR and knowing how to use a heart defibrillator device. In Bryan, Talley, KRHD News.